Hello. Good afternoon. Uh, Happy New Year to everybody. This is the first case of the year. It's a very interesting case today. Um, Give me 1 second, please. So this is 73 years old woman that was sent to us because jaundice and elevate white cells with 60,000, and also lesion, a tumoral lesion in the distal part of the biliary tract. This is a cholangiocarcinoma with invasion of the cystic duct. So now she have acute cholecystitis and also cholangitis. So we need to treat this patient. How we will perform this approach today? So we see during the endoscopic ultrasound, she have peritoneal carcinomatosis, and also she have 4 millimeters of the diameter of the gallbladder, with a lot of pus inside the gallbladder. So this patient need drainage of this gallbladder because surgical resection is not possible due to ascites with carcinomatosis, and the radiologist sent to us also because the amount of ascites was not possible to do a percutaneous drainage. So we will show you today how we can perform a gallbladder drainage in this case of patients. There is a publication from ITOI that I invite you to read about gallbladder drainage in this kind of patients. So we will start our procedure. I am already over my gallbladder. If you see, there is ascites also, but this is not complete contraindication or absolute contraindication to do the drainage, because I see that this gallbladder is very well attached and fixed, so I can do drainage without problems. So I am passing here. You can see the point of my Hot Axios. I will use luminal positile metallic stent, call it Hot Axios. This have in the tip of the dispositive we have electrocautery cystostom, so we can do in a single step all the drainage. So as a tip, so here I am not very far from my gallbladder, so I am sure that I can do it in a single step. Sometimes if you see that we have a lot of ascites, at that moment it's better once you can put a drain, percutaneous drain by a radiologist, and retake the patient the next day, or second, you can pass using a fine needle you can pass a guide wire inside the gallbladder and you can avoid complications. So, but here I am very sure that I can do it in a single step, so I will proceed to do my drainage. I am inside the gallbladder, and now I will proceed to open. You see here my distal part of my lamps of my hot axios is inside. You can see by just by endoscopic ultrasound here. I am inside. I am using a 10 millimeters of diameter of hot axios. Then I have to move. You see, the gallbladder is moving also, so I need to retire a little bit my axios to be sure, and then I can deploy inside my endoscopy channel, as you can see here, and then I need to push, as you can see there. ¿Puedes mostrar la imagen del endoscopio, por favor, también en pequeño? And I arrived to do my drainage very well. You can see here both parts. This is the part inside the lumen, and this is the part inside the gallbladder here. So I already finished my drainage. And I am sure that this drainage was correctly performed. It doesn't take a lot of time. It's really sure. You can see. And I don't know if we arrive to see the. You see here, is the drainage is going well. I don't know if we have the endoscopic vision, but now it's very black. There is I don't have a good vision. I can pass an endoscope, but I'm sure that I do a really good drainage. I will pass now, just to be sure. I will pass an gastroscope I-10 series, just to see my drainage. But as you can see, this drainage is very faster way to perform a drainage from the gallbladder, and we believe that in the near future will be the first step treatment of this kind of problems in patients with contraindication to surgery and due to cancer or tumors. Ok, necesito ver la imagen endoscópica, por favor. Also, it's very important before to do the drainage that be sure that you have a good pass of in the duodenal area. So here's my axios inside the lumen. You can see endoscopically very good drainage, no bleeding, no complications. Toma una foto, por favor. Terminamos. So we finish.